low growth hormone, or too much cortisol. All these things can contribute to that. You are so sweet. That's my handler. Okay, symptoms of andropause. That's from Etta Clark's book, Growing Old is Not for Sissies 2, Portraits of Senior Athletes. That's a real 67-year-old guy. So what is andropause? What does that term refer to? Well, essentially, it's androgen decline in the aging male. And it happens gradually, about 1% to 2% testosterone decline after age 30. And the causes can be decreased testosterone production. So over time, reactive oxygen species in the Leydig cells actually start killing those cells and preventing testosterone production. So the problem with androgen decline in aging men isn't a problem with the pituitary not stimulating the testicles, is that the testicles can't respond. And really, if you think about it, the whole purpose of using hormones, in a way, is because after our reproductive peak years, our mid-30s maybe, up to our mid-30s, we're really not meant to be here. I mean, we're competing for resources. So it's part of nature's way of having us just kind of fall apart and go away is when we lose our hormones. At least that's my philosophy. So it makes sense that testosterone levels start declining because we're really not meant to be reproducing in our older ages. Increased sex hormone binding globulin. So if you make too much SHBG, you don't have enough free testosterone. So that means that you can have testosterone deficiency symptoms even if you're making normal levels of testosterone because the body can't use it. Or increasing of that aromatase enzyme. So that's the enzyme found in the fat tissue, increases estrogen production out of testosterone, feeds back, lowers testosterone production. Again, men turning into women, basically. So how common is androgen decline in aging men, or andropause? Well, the hypogonadism in male study found 38.7% of men over age 45, and their cutoff was 300 nanograms per deciliter. Baltimore longitudinal study of aging found 30% of men over 60 and half of men over 70 had low testosterone. Massachusetts male aging study was kind of interesting. It did not find as many men with low testosterone, only 24%. And only 5.6% had symptoms. And when I read the outcome of that study, I was very curious because men oftentimes don't want to admit their symptoms or may not even realize they have symptoms. So when their testosterone comes back low and I ask them about symptoms, they deny they don't have any erection problems or low libido or decreased performance ability or low energy until their wives are in the room or until you ask their wives, and then they are symptomatic. So I'm very curious about how they questioned those men in that study and what their, what the follow-up was on that, because it's hard for me to believe only 5% of those men with low testosterone had symptoms. It may be even higher if you actually used free testosterone to define low testosterone in men rather than total. 40 to 70 years old is really the age of onset. Unfortunately, I see younger men in my practice with low testosterone. Oftentimes that's due to other reasons. So guys in their 30s who have actually clinically low testosterone could be from a head injury, could be from chemotherapy, could be from opiate use. So I'm sure a lot of your patients are on opiates when they come to see you. And opioids will actually feed back and lower gonadotropins, which suppress testosterone production, which further pain. So consequence of long-term opioid use is actually low testosterone. Spare tire syndrome, what I call spare tire syndrome. So again, testosterone is aromatized into estrogens in the fat tissue, so being overweight can cause testosterone deficiency. But it's a vicious cycle. So being overweight causes low testosterone, but then the low testosterone leads to decreased muscle mass, increased fat accumulation and insulin resistance, which furthers the low testosterone. So really hard to break that vicious cycle. Other symptoms of andropause are low testosterone, low libido, fewer morning erections. So morning erections are a good litmus test of free testosterone production or availability, decreased volume of ejaculate, fatigue and low stamina. And guys will talk about the lack of that competitive edge. They used to feel more competitive at work. They don't feel that way anymore. They don't have the same motivation. They can be irritable and crabby or grouchy. Poor attention span. They're not getting as much done at work. And then depression. And men tend to describe depression a little bit differently than women, more like apathy. I just don't care. Sarcopenia, so decreased muscle mass in men. Muscle weakness. Osteoporosis, anemia, that's actually fairly rare. I probably only see that maybe once a year, maybe less than that. Testosterone has to be very low, but one of the things that testosterone does is it goes to the bone marrow and stimulates erythropoietin. And EPO is the hormone that causes production of red blood cells. So very low testosterone levels can actually cause anemia, and one of the side effects of testosterone replacement can be too many red cells, which is not a good thing for the endothelium or for clotting risk. So really important to consider that if you're running CBCs, especially with a really low testosterone level, that could be the cause. And increased mortality. There are quite a few studies linking low testosterone with increased mortality. So increased death from cardiovascular disease, increased death from other causes. Symptoms of low thyroid. Everything slows down. So if you see a patient and they seem slow in any way, they're tired, their brain isn't processing right, mental fogginess, slow transit time, otherwise known as constipation, which I hope all you define as less than one bowel movement a day. So our conventional colleagues call less than, one bowel movement every 3 to 5 days constipation. It's a tube, right? Something goes in, something should come out. So if they're not having a bowel movement every day, they're constipated. That's not normal. And it could be low thyroid hormone. Also depression. So T3 is found in the synapses between neurons. Very important to be able to have neurotransmitter activity. Depression is very common in low thyroid patients. Swelling and puffiness. So when you start to learn the symptoms of hormone imbalance, you can't help but go around and diagnose people. Like my husband and I will be at the airport and I just want to walk up to somebody and say, this is what's going on for you, because you can see it. So hypothyroid patients, they tend to look puffy. So they'll have swelling, puffiness. And those are actually patients before and after treatment. Sometimes they can say, I feel like something's in my throat, I have difficulty swallowing, and that's because you can have some myxedema actually in that area of the body, in fact, everywhere, which is how low thyroid can contribute to carpal tunnel, because you can actually have a little bit of swelling or edema in the nervous tissue and symptoms from that. So low thyroid causes swelling. Remember that, swelling and puffiness and muscle aching. In fact, the type of muscle aching that a very low thyroid patient will have can be severe. They can complain of it's burning. Fibromyalgia, the worst fibromyalgia, oftentimes low thyroid hormone. Hair loss. So hair loss is interesting. Hair loss on the head, the crown of the head, oftentimes low estrogen in women. Hair loss from a receding hairline can be too much testosterone or too much relative testosterone, not enough estrogen to actually restrain it. And then hair loss all over and eyebrows, especially the lateral third, can be low thyroid hormone. And those are thyroid patients before and after treatment, so you can just see it. Cold body temperature. So thyroid hormone stimulates mitochondrial activity, right? So it's the most important hormone for your metabolism. If you don't have enough thyroid hormone, your temperature goes down, your metabolism slows down. In fact, that's one of the ways that bears hibernate, is actually their thyroid hormone is suppressed. And so it slows down their body temperature and then their metabolism. Raynaud's. So I actually have Raynaud's, and mine's pretty severe, and this is my best indicator of my thyroid levels. So thyroid hormone, remember, very important for the endothelium to make nitric oxide. You don't have enough thyroid hormone, that tissue doesn't work right. Now you can have Raynaud's from that. Heavy periods. Really important to have adequate thyroid to metabolize estrogens properly. And if you don't have enough thyroid and you build up too thick of a uterine lining or you form fibroids, this can actually be a consequence of that. Infertility. In fact, we have a wonderful staff member right now who didn't look like a classic thyroid patient, but she was having miscarriages, and we checked her thyroid. She was hypothyroid, put her on some thyroid, and unfortunately she's leaving in a couple months to have her first baby, unfortunately for us, because we love her. But really common cause of infertility. So your patients who come in and talk about that can be low progesterone, can be low thyroid.
What about amenorrhea in a young woman?
Amenorrhea, absolutely possible with low thyroid. Can be other reasons too, especially if she's a distance runner or if she has very low body fat. It can be inadequate estrogen production. Amenorrhea, common in people who are on opioids. So if she's a pain patient, that can cause it. So impaired left ventricular diastolic function. Low thyroid hormone will cause congestive heart failure if it's not treated. Increased LDL, so low density lipoprotein particles, increased CRP and homocysteine, so increased risk for coronary artery disease, and heart failure. Yeah. Brittle nails, absolutely.
So what do you define as brittle nails? I've had some patients that have, they're not like cracking or breaking, but they're almost too flexible, like they try to,
That could probably also be a mineral deficiency, but it could be low thyroid. Usually brittle nails are nails that break easily, or they just don't grow.
So they're actually like rigid or they like crack, they're not just really super soft.
Yeah, soft nails are probably more of a mineral deficiency. It might be, it's worth checking. I have a patient who is one of those Ironman triathletes, and she was hypothyroid, and her primary care doctor said it's impossible, there's no way you could be doing what you're doing as hypothyroid. And she was hypothyroid. So one of the things I had never asked her about was her hair. I thought she was getting it cut. She hadn't had it cut in literally years. It just didn't grow. And when her trainer checked her VO2 max after we got her thyroid up, she just was off the charts. So she would compete, but she never won. Now she wins things. So she was hypothyroid. It's just that she was incredibly determined, and she had very high testosterone levels, so she was able to compensate. And you'll see this in men. So when men come in, if they're hypothyroid and low testosterone, I usually treat the testosterone first, because oftentimes the thyroid fixes itself. I have no mechanism for that, just clinical experience. But men don't often have the same symptoms as women when their thyroid's low. And their level of fatigue is very different. Women's level of fatigue, if their thyroid's low, it's obvious. They are tired. And I don't know if that has to do with how men just push through things or what, but I don't see the same level of fatigue in men with low thyroid as I do with women. So you are all experts in adrenal hormone, and you can certainly identify a lot of these symptoms. So if you're chronically stressed, you'll have low hydrochloric acid production, because cells require a lot of energy to make HCl, so that can cause digestive problems. Slow growth and healing. This is something you'll hear from people. There's actually a condition called stress dwarfism in children, where kids between the ages of 2 and 15 who are exposed to trauma and severe stress literally stop growing. So their growth hormone is suppressed, so they actually stop growing. Poor wound healing, rashes, hives, and acne, a lot of skin problems, and then rapid aging. So chronically high stress actually shortens telomeres. Telomeres are the end caps of your chromosomes that actually correlate with the biological age of your cells. So every time the cell ages or the cell divides, the telomere shortens. Stress will absolutely cause rapid aging. Can you see? Oh yeah, I put the dates on there for you. What's so interesting is look at Barack Obama in 1 year. I mean, look at how fast those guys age. Regardless of your political beliefs, it's got to be a pretty stressful job being president. So low serotonin or GABA, chronic stress, remember it lowers serotonin in the brain, and because of the high glutamate activity, it lowers GABA. So you can end up with depression, anxiety and pain, migraines will worsen, sleep problems. Low dopamine, dopamine's the precursor to be able to make adrenaline. So the body will prioritize making adrenaline until you die at the consequence of lowering dopamine production. So you can end up with trouble focusing and a worsening of addictions, lack of impulse control. Immune and inflammation problems, so very important to keep the adrenal hormones balanced to not end up with immune and inflammation problems. And again, the body prioritizes survival over reproduction, so you can end up with low estrogen, progesterone, and testosterone, which can lead to all the symptoms that we're talking about because of chronic stress. We already talked about how stress leads to weight gain by increasing appetite and carbohydrate cravings, and increasing insulin and the formation of new fat cells, and reducing the hormones that help you maintain lean body mass, like testosterone growth hormone and preventing active thyroid hormone. Let's talk a little bit about pain and hormones. I imagine you see a lot of patients in pain, and this is such a challenging thing to be able to treat. And I'm sure most of you are interested in treating the cause rather than just getting them out of pain. But just here's a little bit of information on hormones and pain, especially regarding arthritis. So chondrogenic progenitor cells have sex hormone receptors on them, estrogen receptor alpha, beta, and androgen receptors. And estrogen and testosterone have been shown to relieve pain in late-stage osteoarthritis. Testosterone definitely increases osteoarthritis pain. This is something I see in men and women. Men with rheumatoid arthritis have lower DHEA and testosterone, higher estrogen levels. High estrogen in men may actually increase inflammation and pain. Androstenedione and testosterone are anti-inflammatory. They decrease interleukin-6 and CRP and aromatization into estrogens in synovial cells. So really important when thinking about the comprehensive treatment of arthritis to use that. I get better results using testosterone than I do glucosamine sulfate and chondroitin sulfate with arthritis patients. Testosterone assists opioids in crossing the blood-brain barrier, and they're necessary for opioid receptor binding affinity. Testosterone deficiency causes, of course, depression, fatigue, apathy, and low motivation, so trying to get your patients to actually move and exercise can be more difficult. And there actually is some research showing that topical testosterone given to men can decrease pain perception, so headaches and backaches. Testosterone also decreases IL-1 beta, tumor necrosis factor alpha, and CRP, as well as interleukin-6. I should put that up there. So it decreases inflammation, so of course lessening pain. Chronic opioid use can cause low estrogen in women and low testosterone and estrogen in men. This is actually something that the pain docs are looking at now. I have a patient who's a pain doc, and he does screen his patients for low testosterone because it's so common. Remember, it feeds back to the brain, lowers gonadotropin, so now you have decreased sex hormone production. One of my favorite topics is migraines. I personally don't suffer from migraines, but you know, when you see patients who suffer from migraines, it's one of those things you really want to know everything available to help them. More than half of women report migraines associated with their menstrual cycle. Estrogen withdrawal during the late luteal phase can trigger a migraine. So I see this especially in older women. So it seems that the estrogen production from the ovaries can be normal except right before the period happens, which is one of the things that triggers the period to happen is a decrease in estrogen production. Well, that, if it's a rapid drop, can trigger a migraine. So these migraines that you'll hear about from your patients are very classic. They happen 1, 2, or 3 days before the period, sometimes with the period, and they are absolutely treatable with estrogen replacement. So given estrogen at the onset, it can completely abort it, or a few days before. A study that one of my colleagues did looking at testosterone pellets, Becky Glazier, she found a 92% improvement in migraines in women receiving testosterone pellets. I know, it's shocking. I would say I probably see maybe 80% of my patients who have migraines will say they have decreased frequency or pain with testosterone. In some cases, it will completely alleviate it. I've had patients who've been chronic migraine sufferers. Once they get their hormones balanced, they don't have migraines anymore. So something to consider. And migraines are multifactorial, just like a lot of symptoms I'm sure that you see are. Hypothyroidism and pain. Talked a little bit about the muscle aching that can occur with low thyroid and wasting. Joint pain and stiffness, muscle cramping and hypertonicity of muscles can be from low thyroid. Carpal and tarsal tunnel syndrome can be from low thyroid because, again, you can end up with some edema in nervous tissue, peripheral neuropathy. So what are the causes of hormone imbalance? So we're sort of moving into the area of where you can help. So I'm trying to set the stage for that. I like to think of 4 main causes of hormone problems: stress, poor diet and lifestyle, toxicity, and aging. And really the only one we can't do anything about is aging. We can do something about all the other causes for people. This is a slide that talks about the database by the EPA called the Toxic Release Inventory, which is a database of 650 chemicals that the EPA keeps. And these are chemicals that are known carcinogens or have been known to have negative health consequences in humans. And companies are required to report to this database. In 2013, 22,600 companies reported to the TRI. And the combination of that is that 4.14 billion pounds of these chemicals were released into our air, groundwater, and lakes and rivers. So pretty shocking amount of known chemicals. And if you actually want a copy of the TRI, you can get it. I think the slide I put in your handout, if you're following along, was from 2011, because that was the last time, but they just published this data, so I put that in there.
Is that per year?
Yes, ma'am. That is per year. That's right. I know. This is a paper that was published by the Endocrine Society, and the Endocrine Society was started in 1917. They're a fairly conservative organization, and they have a wonderful mission of disseminating information about the endocrine system. And this was a paper that they published in 2009. I think it's about 50 pages, and you can download the entire paper. And it's essentially the evidence up until the point that they published it, linking endocrine disrupting chemicals and anything to do with the endocrine system. So it's all the published data summarized for you. And essentially what they say is that endocrine disruptors affect male and female reproduction, breast development and cancer risk, prostate cancer, neuroendocrinology, thyroid function, metabolism, obesity, and cardiovascular endocrinology. So it's all the data on that. It's actually kind of an interesting read. It will make you mad. But I summarized the key points for you in case you don't want to read it. So endocrine disrupting chemicals are substances in our environment, food, or consumer products that interfere with hormone production, metabolism, or activity. In animal models, human clinical observations, and epidemiological studies, endocrine disruptors have been found to be a significant concern to public health. Effects of endocrine disruptors can unfortunately be transmitted to future generations through epigenetic modifications. And they can cause reproductive problems, so